The floor is yours. Thank you so much. In fact, I am the coordinator of the healthcare department of UNICEF, and I'm representing Florence Bauer. I'm representing Dr. Florence Bauer. I would like to greet all the officers and government officials here on behalf, and also the Minister of Health. And I would also like to greet our sister agency, PAHO, but I'm breaking protocol. I cannot manifest myself for the admiration, my thanks to Dr. João Aprígio, this person that has been fighting for many, many years on this topic. And he is my guru, he is my mentor. When we talk about human milk in Brazil, and in international terms, human milk banks. He is the one who represents that. And I would like to start restating that breastfeeding is at UNICEF's DNA. And we have been following up in terms of global terms. And UNICEF in Brazil has been paying attention to the evolution of breastfeeding and, as a consequence, the milk donation. Yes, the milk donation in Brazil. Recently, we had a national survey that brought the new data about breastfeeding, exclusive breastfeeding for 6 months here in Brazil, exclusively, and as a complement until the 3 years of age.
Ainda mais, né?
There has been progress, there have been advancements, but we still need to improve, mainly because of the pandemic. Breastfeeding has been well discussed. I'm not going to discuss the benefits. You, ladies and gentlemen, are experts in this topic, but I would like to attract your attention for the situation that we're living now. UNICEF last year in Brazil carried out a study with the Ibope Institute about the second impact of COVID-19 on childhood and on adolescence. And what we noticed was a deep level of poverty, a higher level of vulnerability of the lower classes, classes C and D. And this, of course, brought and brings with it great, huge repercussions when it comes to the food security of these children. Before, here in Brazil, we were working hard in terms of the pandemic of obesity. We know that human milk also has a positive impact on non-communicable diseases and obesity. And now we are facing a crucial moment, and we are seeing more and more families, and it lacks food to them. Food is lacking for them. They are facing food insecurity, mainly the families that have young children. And at certain moments, they don't even have money to buy food. And so breastfeeding at this moment is it's a very, very strategic and essential element for all women, for all babies, for all families, and mainly for the most vulnerable families. Because human milk, besides everything that we know, it's free, it's perfect. It's perfect for the child. And so it's important for us to continue letting people know, look, breastfeeding is important, exclusive breastfeeding for 6 months. It's a healthy food. And so research from 2018 give us a sample of the advance and of the enrichment of the industry that manufactures formulas, and they all kinds of substitutes of artificial milk. So it's about 61 billion in sales of formulas and products that substitute milk, but they don't actually substitute human milk. We are facing a huge challenge. The network that we have at a global level is strategic, it's important. We are going to celebrate the 40th anniversary of the code. And here in Brazil, we also have the NBK and its regulation. And it's a very, very important instrument so that we can regulate the aggressiveness, let's put it this way, of the advertising campaigns and also the action of the factories, the companies, of the industry that are trying more and more to substitute human milk and breastfeeding. And these commercial pressures are enormous over the families. And this is another topic, a very serious topic here in Brazil. I know that people from IBFAN, they are here. I believe they're here. Please help us monitor the decode, the NBCAL, and also a stronger monitoring, a stronger monitoring. And so all of the government levels, they should monitor the situation so that we can make the decode and its regulation here in Brazil to become into effect, and also IBECAL. And I was also analyzing a publication, a wonderful publication with data. And so we have the HMBs here in Brazil. And so from 2000 to 2019, we had a huge increase in donors of the milk collected, but we still have a lot of room to improve. We also have in Brazil in 2019, 2,849,000 babies that were born alive, and about 53,000, 53 and 600 babies dying during their neonatal days. And so we must move forward in raising awareness on how important it is for the mothers to donate milk, the importance of breastfeeding, because without breastfeeding, there is no extra milk, and involve not only the women. At UNICEF, we have been working more and more the concept of being a parent. And so I'm here to make this appeal, to you. We should involve the families more when it comes to breastfeeding and also regarding the donation of milk. Many families are starving, and regarding this, the solidarity and the donation of milk. Oh, so many people are donating rice and beans, but we cannot find human milk at supermarkets. So my message is congratulations, and I'm really happy to be here. Thank you so much.